Hello students, this is Perio, Chapter 34, Lecture 1. Concepts of Malpractice and Tort Law. Legal issues in the prevention and documentation of care. Dental hygienists should provide the highest established standards of care, which ensure the safety of the patient who is receiving treatment. This will avoid costly malpractice litigation. However, the success of a lawsuit depends on the quality of the chart notes. There are many definitions in your book that you need to know. Liability is the healthcare worker's obligation to provide services to another person. Malpractice is negligent treatment by the healthcare provider that results in injury or damage to the patient. Tort is a civil wrong action in which a person has breached a duty to another person. Tort is the legal basis for most lawsuits against dentists and dental hygienists. A tort is the law that permits an injured person to recover compensation from the person who caused the injury. Intentional tort is actions designed to injure another person or his or her property. Assault is the unlawful threat or attempt to do bodily injury to another. An interesting example is treating a minor patient without proper parental consent. Battery is the unlawful or unwanted touching of another person with the intention of bringing about a harmful consequence. An example is the forceful discipline of unruly children in the dental chair. Infliction of emotional distress are actions or words that cause emotional distress for a patient. In other words, talking in a loud or harsh voice to an unruly child. Fraud is deception carried out for the purpose of achieving personal gain while causing injury to another person. In other words, being untruthful on insurance claims. Misrepresentation is when a healthcare provider deliberately deceives a patient about possible outcomes. An example is stating, "You'll look like a movie star after orthodontic treatment." Defamation is communication of false statements to a third party about a person that injure the reputation of or deter others from associating with that person. An example is a dentist learning that a dental hygienist is making disparaging comments about his or her work. Defamation by computer is email correspondence and other written documents which are discoverable in court. Do you know who's reading your email? Defamation is something that we need to be careful of in dentistry. Making statements about another dentist's work, no matter how awful the work looks on the radiograph or during an intraoral examination, is not acceptable ever. Trespass is infringing on the privacy, the time, or attention of another, such as discussing a patient's personal information with someone without the patient's permission. This is also a HIPAA violation. Negligence is the failure to exercise reasonable care to avoid injuring others. The failure to do something that a reasonable person would do under the same circumstances. Negligence does not require the intent to commit a wrongful action. The wrongful action itself is enough to constitute negligence, and simply saying you're sorry will not cure it. Examples are accidentally spilling a chemical, not updating the patient's health history, and incorrect treatment of periodontal disease. Professional liability insurance covers only unintentional torts or negligence. The court compares what a reasonably prudent person or professional would have done in a similar situation. Providing periodontal care that meets or exceeds the standards of care is extremely important for dental hygienists. Failure to include a procedure or step in treatment because the dental hygienist was unaware of the current standards will not hold up in court. 10 areas of potential liability for dental hygienists are listed in your textbook, and they include failure to ask or document whether a patient has taken his or her medication, failure to detect and document potential oral cancer, failure to update a patient's medical history, failure to detect and thoroughly document the presence of periodontal disease, injuring a patient, failure to thoroughly document treatment, failure to protect patient privacy, failure to inform the patient, and practicing outside the legal scope of practice. Failure to provide care that meets the established standards of care. Documentation of periodontal care. The dental chart is a legal document. It is the first offense in a legal malpractice suit. Faulty records can be the most important reason for the loss of a lawsuit. All periodontal assessment, educational, and treatment services should be documented in pen legibly. Refer to Table 34-1 on Chapter 34 for documentation guidelines. Advantages of computer-based patient records includes the standardization, legibility, easier and faster access to information, enhanced use of clinical images and radiographs, new ways to analyze information, interaction with specialists, and greater data security. Pitfalls in documentation include making entries in haste or making inadequate entries, skipping lines between entries or writing in the margins or scribbling through entries, altering chart entries, not clearly indicating patient comments, and also insurance coding is important for hygienists to know in order to have payment made to the office. There are many publications that show the codes for insurance reporting, and we will not be covering that in this course. Also, terminology used in dentistry evolves and changes, and some of the terminology that we use in clinic is going to be different in the insurance coding. So you need to know that there are different ways of describing things when it comes to insurance companies. Refer to your textbook for a list of insurance codes. This concludes Perio Chapter 34, Lecture 1.